Hi friends, in this video we shall discuss about spondylolisthesis. Patient presents with pain radiating towards the affected limb when standing for 2 minutes. Whenever the patient starts to walk, there won't be any pain. But when the patient bear weight for a while, then the pain starts. It is the typical feature of spondylolisthesis. On palpation, there will be a palpable step at the lower lumbar region, mainly over L5-S1 and L4-L5. The typical site of spondylolisthesis is mainly L5-S1 and then L4-L5. And the reason is fixed sacral spine and movable lumbar spine is the main cause. One is fixed and other is movable. And that junction, particularly that junction, L5-S1 and also L4-L5 is the typical site of spondylolisthesis. The main clinical feature, the presentation is like that. Whenever the patient bear weight, that patient felt pain. And whenever there is neural foraminal stenosis, then there will be radiating pain towards the affected limb. And whenever there is 50%, that is grade 2 listhesis, then we shall able to feel a palpable step due to the displacement occurred due to spondylolysis, that is fracture of pars interarticularis, and we shall able to feel a palpable step on the affected area. This is the lateral view X-ray of LS spine. You shall able to see there is listhesis of L4 over L5, androlisthesis of L4 over L5, and here you shall able to see spondylolysis, that is fracture of pars interarticularis. It shall be able to diagnose in lateral view X-ray itself, and the grading of spondylolisthesis, if there is 1/4 displacement, 25% displacement, then it's grade 1. If there is 50% displacement, then it's grade 2. Whenever there is 75%, 3/4 displacement, then it's grade 3, and complete displacement is grade 4. Up to grade 2, conservative management is possible. The most important thing regarding spondylolisthesis is to avoid extension. Extension of spine should be avoided. Why? Because in listhesis, due to listhesis, there will be an increased lumbar lordosis and extension should be avoided. The most important clinical feature itself is on extension, patient felt severe pain. And whenever we press the step, a palpable step is there. Whenever there is grade 2 spondylolisthesis, when we palpate on the step, patient felt tenderness. It is the diagnostic feature of listhesis. And up to grade 2 listhesis, its conservative management is possible. And grade 3 and grade 4 includes surgical correction. Coming to the clinical anatomy, please note the structure of vertebra. This is superior articular process which articulates with the inferior articular process of the just above vertebra. And this inferior articular process articulates with the superior articular process. Mainly it's on the posterior side. And this is the joint, facet joint or apophyseal joint. Here you shall able to see the facet joint, and the joining area of superior articular process and inferior articular process of one vertebra is pars interarticularis. Actually, there are two parts in one vertebra. Whenever there is fracture to pars, it is called spondylolysis, and spondylolysis is the puroruba, or spondylolysis is just before occurring in listhesis, and after spondylolysis, listhesis occurs. This is a particular attitude due to listhesis to cover the increased lumbar lordosis, and this is called Fallon-Dixon sign. To cover the increased lumbar lordosis, patient try to be in this particular position, and it causes hamstring stretch. And patient also felt pain over hamstring muscle at the distal end. And this is the Fallon-Dixon sign which we shall able to see to cover the increased lumbar lordosis occurred due to listhesis. And the first thing occur is spondylolysis, fracture of pars interarticularis, and then listhesis occurs. We shall able to see this in oblique view X-ray. In oblique view X-ray, all the lumbar vertebra looks like a Scotty dog. And whenever there is spondylolysis, in lysis, there will be a collar around the neck of the Scotty dog. And whenever there is listhesis, due to listhesis, the head of the dog should be cut like that, and it's called Scotty dog terrier sign or decapitation Scotty dog sign, and it's seen in lumbar oblique view X-ray in listhesis. Normally, in all lumbar vertebrae in oblique view is in the shape of a Scotty dog, and whenever there is lysis, spondylolisthesis, fracture of pars intra-articularis, then there will be a collar around the neck of that particular Scotty dog, and whenever there is fracture, whenever the fracture is displaced, that is due to listhesis, the head of the dog is like cut and separated, so that it's called decapitation Scotty dog sign, and it shall be seen in oblique view X-ray. Bilateral view X-ray itself, we shall able to diagnose listhesis. Here we shall able to see spondylolisthesis, and fracture of pars is lysis and displacement is listhesis. Please note that in spondylolisthesis, we shall able to diagnose it by palpation itself. Whenever it's grade 2, we shall able to feel the step due to the displacement. And in lateral view X-ray, we shall able to confirm it this spondylolisthesis, and we shall grade it. And as per grading, as per prognosis, up to grade 2, conservative management is possible. After grade 3 and grade 4 should be referred for surgical correction. And the next important thing regarding spondylolisthesis is exercise is very important in listhesis, and also after initial amapajana, amashofahara management, snehavana should be incorporated in listhesis. Snehavana gives good result. Also snehavasti, matravasti is also very effective in spondylolisthesis. And rehabilitation, coming to rehabilitation, all the extension exercise should be discarded in spondylolisthesis, and please give isometric exercise without much movement. And in listhesis, if it's grade 2 listhesis, then advice of a lumbar corset is effective in listhesis. And also flexion exercise, gentle flexion exercise with more isometric rehabilitation shall be incorporated in listhesis for better result. And if we done snehabana after amashofahara management, and as the patient to continue rehabilitation regularly, then we shall get good result in grade 2 listhesis, and the patient shall be able to continue the activities with strict lifestyle modification, including avoiding extension, and flexion should be with great care, and avoid trauma. Avoiding trauma is very important in listhesis to avoid further complications. By this particular management, we shall able to make fit the patient to continue their regular activities. Thank you.